Okay, hello everyone, and my name is Rola Kaakeh. I'm the CEO of Salus Vitae Group, and I will be the host for today's Insights from Women Leaders event. Now, for those that are new to the series, welcome. We're very happy that you're here to join us in this conversation. And of course, for those that are returning and that have been to several of these, thank you for attending what you have thus far and for being with us today as well. Now, a little background on the Insights from Women Leaders series in general. We launched this series in October of 2020 as a platform to hear from women leaders with varied backgrounds and perspectives on the topics of leadership, addressing current and future challenges, what skills we need moving forward, and how their experiences have shaped their outlook. The goal is to learn from women thought leaders and decision makers to empower current and future leaders, both men and women, to positively impact their organizations and communities. Now, diversity of thought, experiences, industries, education, and training is important to us, as it highlights the mosaic of perspectives that are represented in different settings that help drive decision-making and positive change. Now, our guests have included leaders from various prestigious and reputable institutions from across the globe. Their backgrounds are diverse, their accomplishments many, and the insights and perspectives they provided are valuable. Now, I encourage everyone to check out the recordings of our previous guest leaders if you haven't already done so. They're all available on our website, salusvitaegroup.com. Now, today, over the course of an hour, we're going to ask our guest leader a number of questions. I'm going to start first, and then I will actually open it up to audience questions. So please submit any questions that you may have in the Q&A box. There's also the chat, but we prefer you to submit to the Q&A box because we tend to look at those first. Now, we also encourage you both during and after the event to post any takeaways that you have from the event. You can post them in the Q&A box, or you're welcome also to post them on social media. And you're welcome to tag us at Salus Vitae Group, and so that we can see how you benefited from the various insights of our distinguished guests. Now, this session is recorded and will be available for replay after the event. Now, let's go ahead and get started. I'm so pleased to welcome and introduce our guest leader today, Mikelle Moore. As Senior Vice President and Chief Community Health Officer, Mikelle leads Intermountain Healthcare's community and population health efforts. In this role, she engages Intermountain and community assets to address complex health issues and to improve underlying social determinants of health, which I'm sure is a passion of many here. Mikelle joined Intermountain as the Administrative Fellow in 1998, later moving on to serve as Assistant Administrator and Operations Officer. In 2004, she became the first female administrator of LDS Hospital, the original flagship hospital in the healthcare system. Mikelle is active both nationally and locally in transforming healthcare and improving the health and well-being of communities. She serves on the steering committee of the National Alliance to Impact Social Determinants of Health and the Population Community Health Advisory Board for the American Hospital Association. She's also active in many local community initiatives, serving as the chair of United Way of Salt Lake, as well as a member of several other not-for-profit boards. Mikelle earned her master's degree in business administration and health services administration from Arizona State University, along with her bachelor's degree in physiology from the University of Arizona. Welcome, Mikelle, and it's so great to have you today with us.
Thank you so much, Rola. It's a pleasure to be here with you.
I mean, even within your title, community, and then as well with your background, the center on community, I think is so wonderful. And I think we're going to be talking a lot about it as well today within your interests. But let's go ahead and get started. So as you've seen in many of them, and especially for our audience members that have heard these before, we ask very similar questions across the different guest leaders. And we always start with the same first one. And that is mostly because people's backgrounds are very diverse. And then here we are today. So now even for you listening to your own background from someone else, did you expect to be where you are today?
You know, I think yes and no. I've wanted to be a part of improving health in our world since I was a young person. I first volunteered in a hospital when I was 14, my neighborhood hospital. And I can't really say why I wanted to be a part of it other than I wanted to make the world a better place. And healthcare seemed like a very logical place to direct those interests. And I had no idea that the job I do today would ever exist. I've never comprehended it. I think at that time, I thought working in healthcare meant I had to be a doctor or a nurse. Didn't really think about the breadth. And yet I can't imagine any place I would rather be when I think about who I am and who I've always been than in this role. So yes and no.
I like that the mention too within the healthcare world as we begin, especially when we're kids, we think healthcare, we don't really realize the breadth and like the ability to do so much and still have such significant impact within kind of the quote unquote non-traditional, non-typical healthcare roles that we would think about, especially as children. Now, we're going to fast forward a little bit, kind of thinking about the future, and then we'll come back to a lot of the exciting things that you're working on with the present. But when you think about maybe your future or the future of what you're working on, what is in your future? What do you want your legacy to be?
Well, I'm not I guess I'll say, Rola, I'm not a very self-centered person in that regard. I think when you ask that question, I think so much more about where do I want health and well-being in our country to be. And I've been in this work now for a couple of decades, and we've made some real progress, I think, in understanding how healthcare needs to change. We understand health is much more than our physical health and the care we receive from our doctor or when we go to a hospital. It's about our mental health and well-being. It's about our ability to feel safe in our homes and have opportunity to learn and grow and raise a family and have a joyful life. And so when I think about where I hope to be a part of transforming health and healthcare and our country is really thinking about having I hope to influence us thinking about healthcare in those different ways, aligning incentives so that health systems like Intermountain Healthcare are paid to keep people well and to help people find joy and well-being in their lives, and that we think about the health implications of the way we design our communities, the way we educate our children, and the way we care for one another in our society. So, I hope that when my kids look back on what did their mom do, I hope they feel like the world is a better place, that we think of health differently in the United States, and that they can see and connect with the work I did contributing to that.
That is wonderful. But thinking about it and listening to you right now, have you always thought about it like that, or have any of your past or even maybe present experiences really shaped this outlook for you?
I certainly don't think there's any way I've always understood the impact that racism, for example, has on health outcomes. The last year, in fact, has shaped our understanding of that. But when I think back to, I first thought I wanted to be a physician. Then I realized that, during the 90s, that primary care physicians were having a tremendous impact on health and well-being by becoming that, we used words like gatekeeper or the person who coordinated care. And I thought, well, then rather than being a specialist, I really want to be a primary care physician so I can think about that whole person. And then I realized that even beyond an individual provider of healthcare, that there were health systems that were really contemplating the care of populations. And I thought, I want to understand that. I want to think about how physicians and hospitals and health plans working together can really change health outcomes for a population over time. And so I feel like my life experience in getting to know healthcare has helped me kind of one building block at a time, understand the systems that contribute to health and well-being, the systems that we all live and interface with. And I'm still adding building blocks every day, every year, as I come to understand what's contributing to those systems of health or those systems of illness, both in a true healthcare sense, but also in a societal sense. You know, what's contributing to a healthy society versus detracting from it. And I think that will just continue. I can't imagine that what I will know, or I hope what I know a year from now, will be the same as the way I think about it today.
Yeah. Which actually makes sense to your kind of perspective of going beyond yourself, because if you've built over the years these stepping stones, or kind of built, you get farther along with necessarily that's just focused on you, because you keep learning about these different elements, which then get you to see the view quite differently. Or if you want to look at it from a mountain perspective, like, right, you kept stepping, so your view is going to be much more broad, and therefore your legacy, that how you even started off for saying, it's just going to be much larger because the perception of it. And I think what was so valuable in what you said is your kind of willingness to learn these various different elements, right? You know, within, whether it be last year or within in the past several years, as more and more we have access to information, the more we're understanding and the more we can learn how to apply that, right? To build that, I think is very powerful. So yeah, thank you for sharing that. And I think it's very valuable for people as they try to think about whether they want to go more narrow or go more broad about looking at that. Now, we do talk a little bit. So obviously you've had and are continuing to build a successful career, and we can talk about success later, right? But in terms of the actual, as you're building your own career, but can you share with us maybe some failures or challenges that you experienced that you are learning from, that you're taking as you're moving forward?
Oh, I've had so many. You know, I think from an early career perspective, and something I often talk about with younger professionals, is how many jobs I didn't get, and opportunities that I didn't have that I thought were that next pivotal thing, if that makes sense. You know, it was mentioned in my bio that I was an administrative fellow for Intermountain, which is a phenomenal position where you get to work in all different parts of the organization and interface with the board, as well as interface with and observe really frontline things, watch things in the operating room, or help a housekeeper clean a patient room, all kinds of experiences. And moving from that to a job, I really had in my mind that I wanted to manage some aspect of clinical operations, and I applied for, I think, 4 or 5 positions that I didn't get, and then had the opportunity to lead. It was the job called assistant administrator, where I was responsible for leading food services and housekeeping and maintenance and security. All of the things that I bet when I was my 14-year-old self volunteering at Scottsdale Memorial Hospital, I didn't know that those jobs probably existed in healthcare. I may have abstractly, but I did not think of that as a part of healthcare. And I tell people all of the time, as we contemplate what our next opportunity might be, our next, whether it's project or a job or promotion, whatever it might be, I think we often think very narrowly about what that should look like. And I am forever grateful that I didn't get those 4 or 5 jobs that I went after, and I got this other, because no one can ever take that away from me. And to this day, having an appreciation, having helped paint the hallways of a hospital and clean patient rooms and learn how the boiler plant works in a hospital, is knowledge I go back to, but also I really got to know people who contribute in those ways to health and well-being in our community. And it changes my perception of the work that I do even today. And so I think I will always look back on that, and I will continue to try to bring it into my present of learning people, really listening to what their perspective is on the complexity of the work that lies in front of us is really valuable to finding solutions. And thinking about the breadth of the work is is always valuable, and we have opportunities to learn. There are 18 opportunities in front of us to learn, not just one. And oftentimes the least likely presents the greatest opportunity for growth.
No, I like it, because when you've taken that mindset of what you didn't get, which what people might quote unquote consider a failure, or right, that like you were challenged in the sense that that door was closed in that way, but the perception of like it did change, it allowed you to learn new things, to grow and kind of move towards that, I think is really powerful. But just the idea of not just learning from it, but seeing it actually as a growth opportunity in some other area as well. So I really like that. Now, thinking about the future, is there anything particularly that excites you about the future?
Well, I think almost any time we're talking right now, we're thinking within the context of post-COVID growth. And what does that look like? And certainly in working in healthcare, the pandemic has been a very big part of my work and my day-to-day life the last year and a half. So when I think about the go forward from here, I'm really excited by all the things that COVID has taught us. And for someone like me who, works at kind of that intersection of public health and a health system, COVID has brought a lot of very tangible learning to my work that gives us opportunity to look at all of the mistakes we've made in COVID in particular, and how closely correlated they are to the mistakes we make in health and well-being generally in our communities. We often don't see the barriers that exist for certain people to access healthcare or to have the ability to be flexible in their work or in their educational and learning opportunities. There's a lot of disparity in the United States. And COVID has helped us see not only the disparity, but given us real-time opportunities to address it. And during the pandemic, that looked like, okay, why aren't we seeing certain populations testing positive for COVID? And yet they're presenting to our emergency rooms and hospitals very sick. So now we can think about, well, how do we take mobile testing into different communities, make it easier for people to get a test after working 2 jobs on a weekend in their preferred language from someone who looks like them and has a cultural connection. And these are the very same things that we need to be thinking about as we're educating our young people, as we're looking at how to employ people in our communities, and all of the different health issues we're trying to address. When you look at diabetes or mental health, the same disparities exist. And so when I think about mistakes we've made as a community, as a culture, COVID, I think, brings a lot of things into sharper focus and gives us great resources if we will pause and sit and live with what we're learning right now. I think there are great things that lie ahead for us in healthcare, but also in all of the things that contribute to health and well-being in our society.
No, I love it, because I think it gets to the notion that we're often, because there's been so much attention, and rightfully so, on the pandemic and within that year. But like you said, there's so many things that we learned or brought to light, or even conversations that we've been having for a long time, but now have gotten the attention, now are at the forefront. Now more people are talking about it. So how do we utilize that? How do we best say, like, it works or doesn't work in this particular instance? And then how can we, it doesn't necessarily ensure that the lessons learned, if we applied to maybe diabetes, like you said, or other, epidemics that we currently have, it might work, it might not, but understanding, like you said, the systems, right, that are beyond just maybe an individual that we can help contribute to. So I think, yeah, that definitely is so exciting, right? What do we do with what we've learned so far in the future? I think will play a big role. Now, as we're thinking about all the challenges, and like you said, there are several, and I think we can have several hours just just talking about the various different challenges. But as many of us look to build our own skill sets to maybe tackle some of these challenges or the own challenges that we're working on either as an organization or as communities, what tools or maybe mindsets or skills do you think that we should start to either think about or equip ourselves with to continue to address these big issues?
You know, when I think about where we are as a world right now, I think there is such a need for compassionate listening, getting to know other human beings' needs, wants, desires, and really, you know, I think so much, Rola, about what plays out in our media right now in terms of misinformation or extreme communication on either the left or the right, and I think the greatest tool we need is creating more human, personal connection. And as leaders, it's really important that we are modeling that we are practicing it, that we are doing it, and that we're listening to lots of different voices. And we're often surrounded by the same voices, whether it's in our news feed or our leadership, our management teams, or our neighbors. We are a society that clusters, and that's human nature. It's nothing to apologize for in any way. But in order to really listen and hear diverse voices and ideas and understand how to change problems or address problems at scale, we need perspective that moves beyond those clusters. And so I think the most important tool we need to use right now as leaders in the time and place we find ourselves is listening. And that's active listening. It's looking for the voice that you can't hear, whose voice isn't at the table, and how do we seek that out, listen, and really seek to understand.
Yeah, 100%. So we can seek to understand, to learn, and then to incorporate, like you had mentioned earlier, into a lot of the initiatives that we're doing in order to build and move forward. Yeah, it's so wonderful. So now let's talk a little bit more. Now let's talk about the present. So what current initiatives are you working on that you're excited about, that either maybe have emerged as a result of the pandemic or something that you've been working on for a while that you've really seen grown?
Well, in my job, I get to do a lot of really fun things. You know, as you mentioned, as you introduced me, my job is to really look at the complex community health issues we're facing in the areas in our communities, and think about the assets Intermountain Healthcare has. And we're a large organization, more than 40,000 employees. We're primarily in Utah, but are based in Utah, but have services in Idaho and Nevada, and have a virtual reach across about an 8-state region from Canada to Mexico in our Intermountain West area. And yet we see our opportunity or our responsibility as a nonprofit health system to be a part of also changing the way our country thinks about health and well-being and healthcare. And so my work ranges, or my team's work ranges from things like addressing the opioid epidemic and thinking about suicide prevention and what can we as a health system do? And then how do we partner with the community to change perception and stigma and awareness and understanding of resources? So I have a lot of fun work going on there. And we're thinking about our non-traditional roles outside of the healthcare we deliver and the impact we have on health. And sometimes I get a little even more excited about that because I'm still learning and think there's such greater applicability than beyond what a health system can do. And so I'll share a little bit about that with you. We refer to it as our anchor work. So a healthcare organization is rooted in place, where a hospital is a part of the community, and therefore we are an anchor organization. We're not going to relocate to Pennsylvania on a whim because there's a good tax incentive or opportunity for a different labor force. We hire from this community predominantly in order to care for this community. And that means that through the way we hire and the career opportunities that we create for the 40,000 some people that work for us, we can actually influence health. We know health is in great part, determined by our educational attainment, the opportunity we have to generate income for ourselves and create wealth for our family. That contributes and is a strong predictor of our long-term health outcomes, more so even than the healthcare we receive. So we are looking at how do we ensure that we are successful hiring refugees into our communities or into our hospitals, not just as environmental services workers or food service, which is where we've traditionally hired refugee individuals into our hospitals. We're now hiring them into phlebotomy jobs and thinking about then how do we help them get education to progress, if they want to, into clinically more complex roles and higher wage earning positions so that they have opportunity for wealth building. And that takes real intention and hard work and trust building, but has great power to influence health and well-being. And if we develop these career progression pathways over and over and over again, we can change health and well-being. Similarly, we are thinking about the way we purchase and procure goods and services. About half of a healthcare system's expenses are spent on buying supplies, everything from coffee to complex implants that go into our bodies. And with a lot of those goods and resources that we're buying, we can support locally owned businesses, minority and women-owned businesses, and help change the economic opportunity in the communities we serve, which in turn improves health and well-being. And so I'm really excited. This is relatively new thinking for a health system and something that I think has great opportunity to reshape the way we think about health and well-being. And recently, we've been developing really, I'd say, really fun conversations with other sectors in our community, with the education sector, with the housing sector, and other businesses who have similar type of opportunity to influence that we do as a major employer in our community. And I get really excited thinking about that multiplying effect. If we're all thinking in a more community-minded way, we can really change the communities in which we live. And we'll continue to do our part, of course, in addressing the health conditions that result for people. And that's always going to be first and foremost. But I'm excited about thinking about the more upstream ways that we can be influential in changing our communities.
Yeah. That's a wonderful thought process because it gets beyond, and like you had mentioned, right, as a health system being mere and recognizing that health goes beyond just the healthcare we provide, right? And so being part of the community, not just as one that provides service like the healthcare services to that community, but really being a part of contributing in multiple different ways that all impact health. Right.
Mm-hmm.
And like you said, great as they grow. And I think that that's a wonderful way of looking at it. And I love how optimistic this is and builds all this part. But are there anything particular challenges that keep you up at night to not that, you should lose sleep, but, anything that worries you towards kind of these barriers towards optimizing this approach or this thought process, anything that you are constantly thinking about that you feel like you have to overcome in order to continue to move forward?
Two things come to mind. One, the things that keep me up at night are, probably still really connect to those health issues that we're working to address. When I think of how many people today are in our hospitals with COVID, a preventable disease, now with the wide accessibility of vaccines, and why is it that we are still seeing people sick with COVID? Those kinds of things really bother me. Not having access to mental health services for everyone who needs them, either because we don't have systems that support people, or because there's shame or concern about seeking treatment, and then losing someone to suicide. Those kinds of things really keep me up at night. But when I think about then what is the problem to be solved, or the barrier, what worries me, I guess, is the complexity of trying to rally people around solutions, and the belief that these problems are solvable. I truly believe that every problem we face in our community's health right now is solvable. And what really ultimately frustrates me is finding people who believe something different and believe that the problem is insurmountable, or that the barriers are acceptable, that they just exist and it's just okay. That's what really ultimately worries me.
Yeah, because it's a very different process when you maybe are working with someone that believes that there's a solution out there. You just now have to focus your energies on determining what that solution is, or what that looks like in that action, versus, if so much of your energy is still in kind of the convincing that it is solvable, right? You're not then spending that time to find that solution there. So let's talk a little bit about success, whether it's in the projects or programs that you're working on personally, or your own definition, whether it be your career or your own personal perspective on success. Do you have a definition for success, or how do you define success?
For me, success is defined in impact. I know others might see winning, or increasing market share, or maybe financial remuneration for self or for the company. I really define success by impact, and that can be in a small scale project. If you create the desired impact, that can be a success. But also having a continuously increasing level of impact is really what matters to me, and how I define my personal success.
So as success in general, so whether you're using one metric or maybe even a scale, like you're saying that you feel like it's going to continue anyway. So even if you're not at that last point of success, you're still moving towards that. We know that whether it's for your own individual success, however you define it, or whether it's for an initiative or a project, that the environment and something beyond us also impacts the success or the ultimate outcome. So how do you create environments for success, as we talk about? Either it be within your teams or within the communities that you're serving, or among yourself, your own strategies.
A few things. I think, I think success is determined in part by preparation, and then creating a compelling vision, and then being really good at execution. And a part of that preparation piece is really about assessing the opportunity. Where is there both a need and a capacity and a will to do something? And so much of my work in this space of community health really has to build on that. It has to be about there's a need for something to happen. There are people who care, who want to make something happen. And then there's some capacity by those people or organizations to do something about it. So that preparation of really studying and seeing the need and the opportunity is really critical. And being prepared for that, so that when the opportunity strikes, whether it's a leader or a board member seeing that opportunity and believing in your idea and then chasing it, or just the opportunity to present a proposal to a group of people, you're ready. I think that's critical. Then being able to compel others to believe in that vision, that proposal, that idea is really critical. Now, if you've done the preparation, you know that there's some people who care, who want to be involved with it as well. But being able to articulate that vision, tell a compelling story is really critical to success. And then you have to be really disciplined in managing the people and the processes towards goals. And I think you have to have a very lofty vision outlined. So when we work on suicide prevention, we talk about reducing the suicide rate by 10% over the course of several years. And a lot of people can buy into that concept. Very few people can understand that there are meaningful steps you can take that will actually accomplish what sounds like a really tough, complex problem, but there are. So breaking it down and then managing the pieces you can manage, because we can't manage the suicide rate, but we can manage whether people have access to care after showing up in the emergency room. We can manage whether our frontline caregivers are educated in gun safety. And we can manage the public awareness campaigns that influence children's ability to talk about this with their families. And so distilling a complex problem into very manageable steps and then managing the execution, I think is the last piece of building out that success.
Yeah, those are great, because it definitely brings it down to also identifying, like you mentioned, what we can manage and what we can't, but ultimately what we can manage, if you have those actionable items, will still make an impact on what we thought we could not manage, or, at least in terms of the actual processes there. So let's talk a little bit now about leadership. Obviously, this is a leadership series, so many of our audience members are very interested in kind of the conversation around leaders and leadership. So just give us kind of like a basic definition or something, very brief, and maybe if you can go into a little bit about what shaped that outlook for you, but how would you describe a leader?
I think a leader is someone who serves first and foremost, serves the community, or if it, in my case, I always think community, but I recognize it could be shareholders. So there's service to those you're trying to provide for, but also service to those you lead. And I think one of the most important, I think we often think of that external force, if you will, but service to those you lead is equally as important. And by that, I mean tapping into their potential, creating that growth opportunity, empowering people is the only way to truly create that service to the external force. And so I think leadership has to be both of those things in fairly equal balance.
Yeah, that's right. So obviously the topic of leadership is very common. People talk a lot about it. There's so many books, there's different conversations. But as you listen to it and throughout your experience about working with various different leaders or thinking about leadership in general, what do you think we're getting wrong about leadership? Like as you're hearing these types of conversations or seeing how leaders are developed?
One of the things that I think we most often get wrong in leadership is believing that our individual success or our individual accomplishment of a project or our own metric, our own key performance indicator, if you will, creates leadership. And when we're solving the complex problems we're looking to solve today, the success of the team is far more important than the success of any individual contributor. And in fact, if we're really using leadership effectively, the sum of all of the individual contributions of a team should be greater than the individual contributions add up to. And I think we get that wrong over and over and over again. I think leadership is often thought of as an individual attainment, individual success. And in fact, I think even as leaders, we may even promote people who show that individual success, when we should be looking a little bit further for what leaders inspire team success, team accomplishment, even cross-sector accomplishment across organizations. And we have fewer metrics for those team accomplishments in any sense. And therefore, I think we often focus on the individual accomplishment.
Yeah, I like how you're tying in that the evaluation of the individual beyond them as an actual individual to evaluate their leadership, right? Because we often talk about position. I was going to say evaluate the leader, but you've actually determined that they don't become a leader until you evaluate them based off of certain metrics that go beyond themselves, right? So you go from that individual to that leader based off of also what metrics you had evaluated. So that's really powerful because it gets you back about serving beyond you and thinking about your teams as a leader. Now, many of our audience also think a lot about how they build themselves as either leaders or within their organizations, or however each individual defines leaders, because some define it as a position that they're seeking or whatnot. But what specific leadership advice would you provide for people maybe at various stages of their career? And you can be particular about with whom, or give general leadership advice for those that are thinking about leadership or interested in maybe being a leader.
So I think first, when I think of someone who's considering being a leader and is curious, I think it's really important to express that curiosity to someone whom you trust might have your back as a sponsor or a mentor. And I think this is really true at any level of your career. For really established leaders, there's always opportunities to grow as well. And I think we are best served by sharing our interest and our curiosity at whatever level of leadership we're seeking, and then getting very specific as that curiosity matures around how to develop some skill sets that will help advance to that next step. So I'm a huge proponent of both having mentors and being a mentor. And I think it's really important to do both at every stage of your career. You always have something to offer someone else in your shared experience, or in sharing your experience, sharing your failures, sharing your perspective. And the practice of doing so helps you develop your leadership skills. And then by seeking mentors and engaging and utilizing mentors, you really have the opportunity to learn a lot through their experiences, but you also begin to have people who will be active sponsors for you. Really look out for that next opportunity for you to grow or have a promotion or take on a project, whatever the case may be. And so I think that's the best advice I can offer. Yeah,
the twofold though. It also brings you back to the initial point about listening, mm-hmm. right? Because the ability to learn from others, makes you a better listener as well. And then the contribution beyond yourself is what you're generously providing others in terms of being a mentor as well. So before we open it up to the Q&A, we do always have a final question that we ask all of our guest leaders before the Q&A session, because we do like to take an opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who's inspired you, and why did you choose this person?
Two people come to mind, and they're really different influences in my life. The first is Gail Miller. Gail Miller is the chair of the board for Intermountain Healthcare, and so she, by that position, should be in a role of influence for me. But that's not why I find her an influencer. She is a business leader here in our community who worked for decades in the shadows behind her late husband. And once he passed, she stepped into the unplanned role of leadership for their companies and has taken that role in the most humble way, of really, I think, listening to, kind of following some of those things that I described. She's been a studier of business for her whole life, very quietly preparing for this moment, and sees very adeptly the needs and the opportunities that exist in a community, both from a business sense. She's grown the business tremendously, but she also sees the needs from a homelessness perspective, the need to create better social dialogue, the importance of addressing racism in our community. And she speaks to it. She doesn't shy away from it, and she invites others into the conversation. And she shares, as she does this, her own personal growth. She's not shy about acknowledging the way she's been influenced by activities around her or her own experiences. And so I continue to watch her and try to learn from every interaction that I see her have in the public, but also that I have with her personally. And then the second woman that I think of is my daughter. My daughter's 14. She's a woman in some sense of the word, and still becoming one. And yet, I often find myself in a day checking my own thoughts, worries, and concerns with how would Ainsley think about something. She is a very self-assured person who doesn't get caught up and bothered in the distractions of life. And I don't know how she finds that grace at the age of 14. But I find myself centered by thinking of her and trying to see the world a little bit more through Ainsley's eyes as I watch her grow. And so she inspires me too.
Yeah. I like the theme of it's very much like being courageous, being humble, being real with regards to these two individuals and kind of the wisdom at any age, right? Like you had mentioned. So there's so much that we can learn from others, but oftentimes it's the influences in different ways of how they either learn new things or tackle on the various challenges like you had mentioned earlier. Now, the audience, if you do have any questions, we do have a few, please submit them in the Q&A box, or you can also submit them in the chat. Now, a question that we got is around, how do you prioritize community needs? Where do you focus your efforts first?
Well, we take a very academic approach to it in one sense of looking at lots of data about what problems exist, but also what assets exist. How can what resources exist to try to address those complex problems? But then we also do a lot of talking and or listening really to people in the community. Just as I described, we can look at the data in a public health sense and see that our suicide rates in this part of the country are higher than the rest of the country, and that they are increasing at a rate that is concerning. But if we only saw that public health indicator and we didn't also hear in every community we serve that this is the issue that communities are desperate for solutions for, and that they want to be a part of finding those solutions. They want to be engaging as schools, as businesses, as government leaders, as community-based organizations, then it wouldn't be possible to do anything about it. And so the prioritization process really has to take into account, is the need really great? Yes. Is the will or the activation of the community present in order to address that issue? Absolutely. Check that box. And then the other component is, do we have a capacity to influence it? If a healthcare organization doesn't have any resources to bring to bear, other than maybe some charitable contributions we could give to the issue, then we're not going to be very impactful in addressing it. And in fact, when we started looking at suicide as an example 10 years ago, some of our physicians and clinicians and administrators said, well, for the most part, People aren't dying by suicide in the health system. They're dying in their communities, in their homes. How are we going to possibly get our arms around this? This is influenced by so many other things than by what we're doing. And that made us hesitant. And yet, as we began to study the problem and really see what the opportunities to influence, we realized that we see people in crisis all the time in our emergency rooms, in our clinics. And by having an intervention at that point in time and creating greater access to services and follow up to that crisis, by talking with people about how to store firearms while their family members in crisis, and create some real-time protections and a safety plan, we can absolutely change this as a health system. And we can partner with all of these activated groups, employers, schools, community-based organizations, the PTA, and we can change the dialogue around how we talk about stress, how we talk about our mental health and well-being, and help normalize it. And so the work becomes really tangible, and that ability, that capacity increases the way we would prioritize a health issue as well. So we have to look at those multiple factors in prioritizing what we work on.
So another question that we have, and I think this is one that we get similarly a lot in terms of the topic, but because oftentimes, and many of our guest leaders actually have come on and said about the importance of engaging with diverse stakeholders. So do you have any strategies for those that either are doing it or are, hear the importance of engaging diverse stakeholders, about a process that you take necessarily when you're starting to either initiate a collaboration or think about talking to non-traditional either partners or these types of diverse stakeholders for your initiatives? Or is there any advice that you can provide?
Sure. So we've been engaging some diverse stakeholders in a project that we call the Alliance. It is an alliance to address the social determinants of health. I've mentioned in response to other questions that we recognize that income, housing, education influence health and well-being. But what can a health system really do to address those issues? Well, we thought, there are, as a health system, we have the opportunity to probably talk with our patients about, do you have access to healthy foods? Do you have a safe place to live? Do you have a job? Do you have steady income? Or are any of these things a concern for you? And then there are partners in our community who are seeking to solve all of those problems. There's food banks, there's housing assistance organizations and shelters and government programs. So the concept of the Alliance was, what if we were to work with all of these diverse stakeholders to help meet the needs of some of the most vulnerable in our community? And so we started by saying, do you all agree that working together might bring some benefits for the people that you serve? And if so, and they said, yes. Great. Well, we should probably start by listening to those that we're trying to serve, and listen not with our one perspective in mind, but the full needs of the patient or the person. So their health needs, as well as their food, housing, safety needs, et cetera. And so we really started by doing in-depth interviews with people that we were looking to serve and listening. And I think that's a really important part of working in community and working with diverse stakeholders, is that listening function, really actively listening, and then listening to each of the partners about what they thought they needed to solve this problem, and then creating a continuous feedback loop around, at every step of the process. What are we learning? What's working? What isn't working? How do the people we're serving feel about the services that we're providing? And what opportunities do they see? And creating that continuous loop for stakeholders to work together. We have to become a team in order to accomplish the goals that we share. And so, I think anytime we are trying to work with diverse stakeholders, we have to find creative ways to hear their perspective. And if we don't have a relationship of trust established up front, which usually we don't, We have to find ways to really ensure that we're listening first, and then identify what do we mutually care about, and then set goals around that and create a continuous feedback loop for how well are we doing at meeting those goals.
So what I really like is I was hearing that, because most of the time people identify a partner and then they go into a meeting, here's what we think are solutions, what do you think are solutions? And then it kind of begins this like kind of battle of the, you know, which solution are we going to go with? But what was nice about how you described it is that you both identified the need, and let's work together. And you went back to identifying the need within that community. So focusing it back on that, understanding that before you come. And it's still very needs-based. Then it talks about what does each organization or each stakeholder need, and then you figure out solutions. But oftentimes we all come in thinking we have the solutions before all those steps happen, which I think is really significant. Because one, you set, like you mentioned, you build that trusting relationship where each side really understands where each side is coming from, without the assumption that, well, you're in this sector, so I'm assuming this is what you care about and this is what you need to do. And I think that definitely, like you had mentioned, gets you at a different point of when you get to your solutions, and then understanding, did those work or not work? So I think that is really beneficial for a lot of people listening about that, because it really gives you tangible items to think about as you're engaging with those stakeholders. So think about what your actual step process is when you engage them. So we do
think about it even as, what's the problem to be solved? Because oftentimes we're more focused on the solution we think we have. And if it's not solving a problem, we create obsolescence for our solution.
Yeah, we do have a comment here. Very much appreciate the insight of finding intersections of all these stakeholders, with definitely keeping that whole community needs and understanding that first, and then each understanding the community within that organization or that stakeholder, and then building beyond that. So yes, I agree. That was very, very powerful. Now we do only have a few more minutes, Mikelle. So are there any other final thoughts or items that you want to add to the conversation that we've had thus far?
I guess I would just say, you know, because we are, this series is about women and insights from leadership, how important it is to support one another and encourage one another's growth and development. Don't underestimate the power of doing that for someone else. And I always underestimate that in myself. And so just encourage us all to be reminded to encourage one another and be kind to ourselves and to each other.
Yeah, no, I love that. And I think that's definitely something that we find very important as well. But like you had mentioned, sometimes we support one another in various different ways, whether it be small or large, but not to overlook the significance of even the small ways of supporting one another, for sure. So on behalf of Salus Vitae Group and myself, I would really like to thank you for joining us today. I really enjoyed this conversation. I think every point that you talked about, I literally wanted to ask you several other questions beyond that to build upon that. So I know that you guys have various different things that you're working on, a lot of the work that you're doing within the community. So definitely people that are interested in looking at anything that Mikelle was talking about, of looking beyond your organization, thinking about the community, you can reach out to us and we can guide you at the different work that you guys are doing as well. So I know that a lot of people are interested in how do we begin to think about the broader issues and create those recommendations internally. So thank you so much for being a part of this series and for your support and contribution to the conversation around encouraging more women leaders as well. So thank you everyone for attending. Just as a reminder, there are several other women leaders in the coming weeks, so you can register for all of those on our website at salusvitaegroup.com. And please let us know how you benefited from the different sessions as we move forward as well. So thank you so much, Mikelle.
Thank you, Rola.